This presentation was kind of born from our vector for surveillance program. So through environmental health and public health, the state contracts us to do mosquito and tick surveillance across the county to report back to them and do some testing for different diseases. There are three main parts of that program. The first one is looking for invasive Aedes mosquitoes. We have a certain trap for those that I'll show you in a little bit. Those primarily carry Zika virus. We have never found them before in Ottawa County in the 8-ish years we've been looking, which is a great thing. We don't want to find them, but we still look for them every year just in case. Culex mosquitoes are next. They are the main vector of West Nile virus, but they carry some other diseases as well. We have a different trap for them, and those are the ones we primarily send to the state for testing. And then last, we have ticks. We're looking for a bunch of different ticks, primarily black-legged deer ticks that carry Lyme disease, but we record any tick species that we find, and if we find some invasive ones, we definitely tell the state right away. So for ticks, we have a specific trapping method for those, and right here I have our handy dandy tick cloth if you want to unroll it. So basically we take this out in the woods on the trail, go right next to the trail, drag it through the leaf litter like this guy's doing right here. We go, each drag that we report to the state is about 1,000 meters. So we go about 10 meters at a time, pick it up, pick all the ticks off we get, put them in a little vial with ethyl alcohol, and then go again. We do that about 100 times for one tick drag, and then record what we get. So last year we did 26 tick drags. That was by far the most we've done in any of the years we've been doing, but I think this year we're already past 10, and we do this beginning of May through early September. And once we get the ticks, we speciate them, report them to the state, and keep the records for ourselves. This is just a list of some of the ticks that we find throughout Michigan. American dog tick, most common, right at the top there. Those are pretty much everywhere. Black-legged ticks are the Lyme disease ticks. Also in a lot of counties, but not all of them. You can kind of see on that little map there. Next most common, well, not necessarily. Lone Star ticks are the next one we're worried about. We rarely find them in the county, maybe once or twice a year. Woodchuck ticks, we don't really ever find because, like the name, they only really bite woodchucks, so we're not worried about them. Same with brown dog ticks. They really only bite coyotes, other similar animals. Sometimes they get on pets, but barely ever people. So yeah, the three tick species that we're mainly looking for. American dog tick, like I said. Those are the largest. The main disease they carry, Rocky Mountain spotted fever, which is a super rare disease, especially in Michigan. I mean, less than one case per year. Typically, I think I've maybe seen it once, and it didn't have anything. It wasn't even from Ottawa County. Next, black-legged ticks. They're a little bit smaller. The females have that nice orange bottom there that you can kind of identify them pretty easily, but the nymphs can be as small as a poppy seed, so they can be hard to identify. Lyme disease, the main one for those again. We kind of assume pretty much every population has it because the adult female infection rate for Lyme disease is 36 to 40%, so a lot of them have it. Lone Star tick, next ones, they're super easy to identify. The females have the big white dot. They carry alpha-gal syndrome, which is red meat allergy. So a little bit scary. It's not fun getting bit by one of those and getting alpha-gal syndrome, but like I said, they're super rare in Ottawa County. We find maybe a couple a year. More on ticks and their distribution. So by far, most common tick in Michigan is the American dog tick. Slightly less common, but we still find quite a bit, deer tick, kind of distribution throughout the country of those. Distant third is Lone Star tick. So this map is a little outdated. It doesn't show them in Michigan. They've been moving up north more and more every year and making more established populations. When we do get them in Ottawa County, it's usually from them being carried in by a bird or something. The Asian longhorn tick, we've never found one of those in Ottawa County. They're just starting to enter Michigan. So yeah, if we find one of those, we definitely let the state know. Questing, so this is how ticks attach onto people. Basically, they go out in the leaf litter or on a plant, something, raise their arms up in the air, grab onto whatever comes by them, crawl up that, and then bite as far as they can. Ticks don't jump. A lot of people think they'll jump up onto you. They don't, they just grab and then they crawl. So if you find them in the hair, they've probably crawled all the way up or gone from a plant and come down. But they don't jump, they don't fly. This is kind of the life cycle for black-legged ticks. So there's 2 peaks throughout the year for adults. Early to mid-spring, kind of April, May is when we see them the most around here. And later in the year, September, October. In the middle there's kind of when the larvae and the nymphs are hatching and growing. And that goes down as the adults grow up and then hibernate for winter.
Thank you, Nick. Nick works for our environmental health program. Thank you very much. My name is Julie, and I work in communicable disease and tuberculosis. I'm one of the registered nurses. So I'm going to speak a little bit here about tick-borne illnesses in the United States, but specifically in Ottawa County in Michigan. So on this screen, you'll see there's a list of several different diseases and illnesses that ticks can cause. And these are ticks that are found in the United States. So specifically, we're going to speak about Lyme disease right now. Lyme disease is a bacterial infection that's spread to people through the bite of a black-legged tick. Specifically, we get it through the saliva of the bite. Early signs and symptoms of Lyme disease begin about 3 to 30 days after the tick has attached to the person. Generally, ticks have to be attached for at least 24 hours, but some will start to show signs of fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes. One or a mixture of those. And those are also common signs and symptoms of other tick-borne illnesses, but Lyme disease is one of the most common ones we have in Michigan. And then the erythema migrans rash, that is found in about 70% of people that have Lyme disease. So it's a very good indicator. If Lyme disease is untreated, it can progress to more long-term chronic problems. Facial paralysis or Bell's palsy is one of them. And as you can see in the bottom left corner, that person, their face is slightly drooped. Along with that, they can have some chronic fatigue and other symptoms. Many times that is temporary. And then the arthritis, some people can have long-term severe joint pain and swelling. And then also Lyme, if it's left untreated, can affect the heart as well. So let's talk a little bit more about the erythema migrans rashes. So the one rash on the top left corner is the classic bullseye rash. That's what people tend to think of when they think of an erythema migrans rash. But the other 3 are also erythema migrans rashes, which there are actually many other different ones. We just included a few. The top right corner of that slide where there's multiple spots, that's early disseminated Lyme disease. Then on the bottom left-hand corner, that's an early expanding erythema migrans with a nodule. And on the bottom right is a red oval plaque. So one thing that we do at the health department is try to educate our providers in the area on the different forms of erythema migrans rashes so that they can be on the lookout for that.
Thank you, Julie. Hi, everyone. My name is Drew Glass. I'm an epidemiologist with the Ottawa County Department of Public Health. I'm here to talk today a little bit about the numbers. So Lyme disease in Ottawa County, when are cases occurring in humans? Just to give us a sense of if there's seasonality to it. A few slides ago, there was a slide that showed a couple of lines about different periods of activity for ticks in their different stages. So if they're in the larval stage or the nymph stage or the adult stage, there's different times when they're active. But when we're thinking about the risk to humans, generally what we see is like all through the summertime, including some of the spring and some of the fall. Basically, when the weather's warm, there could be risk for tick activity and the contraction of Lyme disease. So if you're looking at the data here, I just want to show across the last couple of years, just showing that a lot of the Lyme disease cases that are detected in humans are detected through their summer months. And you can kind of see that peaking almost in line with the amount of time and people spent in the woods and in outdoor environments. So June, July, and August, there are some of the months that are the busiest for detecting Lyme disease in Ottawa County. So it's definitely seasonal. We're in the middle of Lyme disease season right now. I don't know if there's a formal term called Lyme disease season, but basically if the weather's warm, that risk is probably higher. But we do see cases reported through the fall and into the winter. And there's some areas that have higher case counts. I don't know the exact reason for this. I don't think there's necessarily a hot zone. I think there's areas that are probably more conducive to being a habitat or a tick environment that could put people more at risk. But there's also some other things from an accounting perspective that make it a little bit harder, like maybe there's a certain healthcare provider in an area that's a little bit more aggressive about testing for Lyme disease. Some of it is just how we test and who shows up for care, who has access to care. But at the end of the day, the reality is that most of the cases that are detected are seasonal and in the summer. And if we look at Lyme disease in Ottawa County and Michigan over time, we can just see that the number of cases has gone up over the last 5 years. So there's two graphs here. One is rate and one is the number of cases detected. Let's start with the one on the right in the green. You can see the number of cases have gone up and up and up, with peaking in 2023. That got to the point where there were a lot of counties across Michigan, public health departments, that were releasing notices that they were seeing more Lyme disease activity and just reminding people about the prevention activities that are necessary to prevent tick bites and Lyme disease. And Ottawa County was one of those counties that released it. So these are some of the highest numbers that we've seen in a very long time. Pleased to show that in 2024 those numbers went down, but they're still relatively high, or maybe slightly above our average compared to those first 3 years in the images here. The rates are on the left, and that shows just like the number of events per population. It gives us a great way to compare, say, Ottawa County to the state of Michigan, just because we're talking about 10 million people in Michigan versus 300,000 in Ottawa County, so the numbers would look very, very different. So we have to do something to kind of give a sense of, to control for the population size. But what that shows us on the left is the numbers in Ottawa County from a rate perspective, which is kind of like the density or the concentration of cases in the population, is similar to Michigan. So those numbers went up in 2023 across the state and have come down at the state level again in 2024. But generally, if we look at the trends, Ottawa County and the state of Michigan have been going up. This might be a detection thing. It also just might be more ticks in an environment that's just more conducive for human interaction with ticks. Pleased to see again a decline in 2024. Hope this continues, but the long-term trend has been up and up and up. So back in 2023, when those numbers were quite a bit higher here in Ottawa County, what we did is we worked with our communicable disease team and others in the county just to do a little bit more deep dive to try to find out if there are any suggestive trends in the cases and what they were up to before they got sick. So what we did is we typically, if there's a reported Lyme disease case, our communicable disease nurses will call the person and ask them about the symptoms they had, about the care they received, if they received treatment, and also what they were up to before they got sick. Just trying to get a sense of the risk that may have been involved, because if you're hanging out in your house and you don't have any pets that go outside, the risk of you picking up a tick bite is pretty low. However, if you are outside and you're wearing shorts and you're walking through like savanna grass and you have a pet that comes inside the house that's been in a wooded area, those risks are quite a bit higher of contracting or having contact with ticks. So back in 2023, those numbers were really high, so we initiated some what we call enhanced surveillance. So instead of just the general questions that we ask people, we asked them lots of questions about lots of other activities they were up to. And honestly, we were seeing more pediatric, so more kid cases of Lyme disease, and our main thing was to try to find out if there's anything in particular, like a camp or a park or a beach or an area that may have been more reported by the cases, just to see if there's any suggestive or correlative information that could help us intervene. So for example, if it was coming from a particular park or a camp or some other activity, that maybe there is something that we could do from a public health perspective. And if you look at it here, you can see that a lot of the things that we're seeing in that most cases reported are things that you'd expect from someone that picked up a tick bite and Lyme disease. So hiking and walking and running, being outside, visiting a park, visiting a beach, visiting a cabin or a cottage, gardening and landscaping, and the list goes on and on. But if you look at the bottom there's a couple of activities like hunting, backpacking, an overnight youth camp where those numbers are quite a bit lower. So if there's any takeaway that's suggestive here, it's that sending your kids to camp is probably not going to put them at a very high risk for tick-borne disease. Usually there's infrastructure and policies in place that help prevent that kind of thing, but from the data that we found, I don't have any evidence of a higher level of risk, especially among our youth and attending youth camps. In addition, we asked about things that people did before they got sick that can be preventative for tick bites and Lyme disease. So asking, before you became ill, did you check your body after being outdoors? Did you check your pets for ticks? Did you take a shower when you came inside? Did you use insect repellents? And you can see there's opportunity for change in education A lot of it is just around like avoiding areas that may have ticks, making sure that you're washing your clothes after you've been outdoors, using insect repellent consistently when you're outdoors. Only 42% of our cases said that they're doing that. So if that was 100%, maybe the number of cases that we had would be a little bit lower. So all these common prevention activities are used by some of our cases, but they could be used at higher rates that may have prevented a tick bite. So you can see some of the stats on the side there. Less than 40% reported showering soon after being outdoors. That's really hard when you're at like a camp or you're at work or something like that. And so that number may just reflect human behavior, but if you're outside, heading inside, doing a tick check and taking a shower can be a great way to make sure that if you picked up any riders that you get rid of them. And then 13% said they avoided areas likely to have ticks. I think that's a great statistic, basically showing that those that are avoiding those areas may be much less likely to pick up ticks.
Okay, so the good news is there are some steps that we can take to help prevent tick attachments and tick-borne illnesses. So ticks are most often found in tall grasses or plants. They're most active in the spring, actually, summer and fall, anytime where the ground is not frozen. This slide gives great tips on how to protect yourself. So if we look at the slide, we see this this person standing in a place where there's some tall grasses, but they're standing more in an area where the tall grasses are not. So they walk in the middle of the trail away from the tall grass, wear long-sleeved shirts, wear white or light-colored clothing to make it easier to see the ticks. You can wear a hat to protect your head and your scalp. Spraying tick repellent on your clothes and shoes before entering the woods. So there's also a product called permethrin that you can actually spray your clothes with ahead of time. Some clothes actually, you can buy it with the permethrin on it already. Wearing long pants that are tucked into high socks and wearing shoes are all good protective measures against having a tick on your skin. So the other part of it, at the top is my little puppy, and at the bottom is my supervisor, Tamara, who was going to be here, but her son and daughter-in-law are having a baby right now. So, but those are her two babies. And just one thing, when we have been interviewing people that have Lyme disease, or actually even at outreach events where I'm speaking with people about ticks and if they're familiar with them, one common question I'll ask them is, do you spend a lot of time outdoors? And some people are like, no. So we talk about pets. Do you have pets that go outside? Well, yeah. Well, that is another way that you can get a tick. The tick attaches to the animal, or it takes a ride with them into your home. They go cuddle up next to you, and then it crawled onto you. So very important to check your pets when they go outside, to check them daily for ticks, and then also speak with your veterinarian about different products that you can use that can help repel ticks. And then this slide is giving us an idea of the picture of what size ticks are. So the one tick on the left on that person's finger is more of an adult size, but they can be as tiny as, you can see that as a dime in the corner picture. Very, very, very tiny. So it's important to do a thorough check. If you think you have a freckle that you didn't notice before, make sure it's not a tick. And, that will be helpful. So if you do find the tick on you, okay, we did all the things, or we forgot to do all the things, and oh shoot, I did my tick check and there it is, and it's attached to my skin. What do I do now? Or you find it on your kid. It's important to make sure you grab the tick with something like a tweezers, and you want to get it as close to your skin as possible, grabbing the head of the tick. And it's important to make sure you're not squeezing the body of the tick, because that can actually bring the Lyme disease bacteria into your body if you do it that way. So grasp the tick as close to the skin surface as possible using a tick removal device, just simply as a simple tweezers. And grasp the tick close to the skin surface to avoid squeezing the tick's body. Pull the tick away from the skin. Don't twist or jerk the tick. This can cause the tick's mouth parts to break off and remain in the skin. If this does happen, your body will naturally push the mouth parts out over time as your skin heals. but you can also remove the mouth parts with tweezers if you need to. If you can't do it yourself, you go see a doctor, leave it alone. Don't want to go digging in there. So after you remove the tick, thoroughly clean the bite area and your hands with soap and water. And then if you find the tick attached to you, you do have to know that there may be other ticks on your body. So do a more thorough tick check, looking for other ticks, and promptly remove them. Okay, next we're going to talk about mosquitoes.
Mosquitoes, similar to ticks, we're looking for them, we're catching them. Dissimilar for ticks, we're testing them. And we use traps instead of the drag cloths to catch the mosquitoes and then sort them. We have these 2 different traps here. We set them weekly throughout different parks around the county. Each one has a collection bag on it that we are able to remove, catch the mosquitoes, and we sort them by species and then put them in little vials, send them off to the state. They test them for different diseases. So yeah, we have the 2 different kinds of traps. We've got the one on the top left there is called the BG Sentinel trap. Those are for the invasive Aedes mosquitoes. As an attractant, they use dry ice that off-gases CO2. Mosquitoes are attracted to the CO2 because they think it's an animal breathing. We also have like little odor smelling things that the mosquitoes like. That gets them into a fan. Fan sucks them down into the bag. On the bottom right is our gravid trap. Those are targeting Culex mosquitoes that carry West Nile. In the bottom of those traps, it's a little tub, and it has like kind of stinky swamp water in the bottom of it. The mosquitoes come down in that, the females, to lay their eggs. Simulates the same environment. And then it's got a fan that sucks them up into the kind of the white trap bag at the top. We take that bag off, take them in, speciate them, send them to the state. Here's a little bit more on the traps on the left there for the invasive ones. The BG trap, you can kind of see the little bag there that comes off. The fan is inside of the main part, so that one sucks them down. On the right there, the gravid trap, the 3 different parts of it. They go into the tub down there, get sucked up into the white trap bag there. You can remove that trap bag and able to sort the mosquitoes from there. Kind of the life cycle of the mosquito, going off that. Adult mosquito lays the eggs in the water. Eggs are in the water for a little while, typically on the surface. They hatch into larvae. Sometimes you'll see them. They look like little squiggly worms in the water. The larvae hatch into pupa, kind of like a tadpole type thing. Eventually, the pupa emerges into an adult, which starts the cycle all over again. Mosquitoes like to lay their eggs in standing water that's not disturbed. So like swamps or at the bottom of our trap is kind of that perfect environment. Across the US, there's 200 species of mosquitoes, but there's about 12 that carry disease. There's 3 main ones that spread disease in the US, that most common disease being West Nile. But of those species and genus of mosquitoes, these 3 are the most common. Culex are the West Nile one. Aedes are the Zika invasive ones in Michigan. There's some native ones in Michigan too, but we're mostly looking for the invasive ones. And then Anopheles is another one. Other parts of the world, Anopheles are the mosquitoes that carry malaria, but we don't have that here in Michigan, thankfully. Back to the invasive Aedes mosquitoes. They're unique because these species of mosquitoes don't actually stay in Michigan over winter. They cannot survive cold temperatures, so when it freezes, they die. So every year, there's the threat of them coming up to Michigan, typically through like containers or old tires that have standing water with the eggs. They get transported up to Michigan, they hatch, and start a population wherever those containers were. It's different every year. Thankfully, we've never found them in Ottawa County, but they've been found in different parts of Michigan. And yeah, they carry different diseases. Zika is the main one. A few other ones on there, yellow fever, dengue. And then over to Culex mosquitoes. So these are native to Michigan. These are the West Nile mosquitoes. There's 2 main species. The species of those look pretty similar. We don't speciate out them. We just, if it's a Culex genus mosquito, we send it in for testing for West Nile. They like standing water, like I said, so storm water, drains, ponds, sewage treatment lagoons, things like that. Yeah, they're the main vector of West Nile disease. Other mosquitoes can carry West Nile, but these guys are the main culprits. And this is kind of a little graph for the West Nile transmission cycle. It kind of amplifies with mosquito biting birds. The virus amplifies inside the birds. A different mosquito bites that bird, becomes infected, goes around and around, gets more and more throughout the environment. Mammals like people and horses are what's called dead-end hosts, so they can become infected by the virus, but a mosquito cannot get infected by biting one of those hosts. So it has to be a pretty specific environment, but it can be transferred to people and mammals.
All right, so we'll speak a little bit about West Nile virus. 8 out of 10 people infected with West Nile virus do not develop any symptoms. About 1 in 5 of infected persons develop fever with the other symptoms that are listed in this slide here. Fever, chills, tremors, headaches, muscle pain, numbness or paralysis, some confusion, neck stiffness, or coma even. Persons 55 and older and those with certain medical conditions, cancer, diabetes, hypertension, kidney disease, those people are at risk of getting a more severe West Nile virus disease. Recovery can often take weeks to months. It's diagnosed with a blood test or a test your cerebral spinal fluid. And the symptoms, also sometimes they put all 3 of that together to diagnose West Nile virus. People infected with it are believed to have lifelong immunity. And there is no medication to treat West Nile virus. It is symptom management only.
Thanks, Julie. Just talking about the impact on humans, West Nile virus is pretty rare in Ottawa County. I don't have the counts up here, but you can see from the rates that it happens at a rate of about 1/2 of a person per 100,000 population, so extremely rare. That doesn't mean it's not dangerous, though. The cases that we do get are often hospitalized or definitely have to seek care and experience some very memorable, impactful medical experience. And so I'm just really glad to say that there aren't that many cases here in Ottawa County. We're a little bit smaller to middling-sized county, which is probably why we don't detect them. But it doesn't mean that we should be lax with our preventative measures. And so we're going to talk a little bit about what we can do to prevent mosquito bites. And mosquito bites are the way that West Nile virus is transmitted. So a lot of those same prevention measures can help prevent West Nile cases from occurring. So not that many reported in the last few years, just a handful.
One of the biggest things is to know the places where mosquitoes live and breed, and Nick did speak on that a few slides over. It's important to once a week eliminate potential breeding areas. All mosquitoes like water, and they especially like stagnant water. So check inside and outside your home and make sure you are discarding that water at least once a week. Old tires like to collect water, so again, discard those. Tin cans, ceramic pots, or other containers that could hold water. And then use screens on your windows and doors and repair those holes that you get sometimes in your screens to keep the mosquitoes outside. And this is just kind of a fun illustration of preventing mosquito-borne illnesses. So on this graph, the neighborhood is talking about how they can mosquito-proof and keep the mosquitoes out of their homes and out of their yards. So again, you can see the tire, somebody's got a bird bath there. Bird bath's okay, but you gotta make sure you empty that water out at least once a week. There are larvicides that you can also treat it with. I'm not familiar with that. But basic eliminating standing water is one of the biggest ways you can help prevent mosquitoes from wanting to live and breed in your neighborhood or your yard. And then also, in our area, daytime is the most fruitful time for mosquitoes, early morning, late afternoon hours, evening. So if you're out during those time periods, make sure you're using insect repellent. If you're in areas where the mosquitoes like to live and breed, like we spoke about, and you can spray your clothes, you can spray your skin, parents help their children, and mosquito-proofing your home. Those are the biggest ways to help prevent mosquito-borne illnesses here in the United States and in Michigan. And so traveling, I wanted to speak a minute about that. I worked for the first half of my career at Ottawa County in immunizations. We do have a travel clinic at the county and see people that travel to various places in the United States. We keep up to date on what illnesses, what insects, what mosquitoes, what they need to do to help prevent getting an illness while they're in another country or even after they return. So it's important if you're traveling out of the United States, especially to places other than Western Europe, to make sure you check with the travel medicine specialist. There may be medication that you can take to help prevent malaria. There may be vaccinations that you can take, like to help prevent yellow fever. Those are both illnesses that we do not have here in the United States. We're going to move on and speak briefly about rabies. So what is rabies? In the U.S., rabies is mostly found in wild animals, such as bats, raccoons, skunks, and foxes. It's preventable. It is a preventable viral disease of mammals, most commonly transmitted by a rabid animal bite. So it attacks the central nervous system. If the person does not receive appropriate medical care after a potential exposure to rabies, the virus can and will infect the brain, and it results in death. I think there's been 1 or 2 cases ever reported, miracle cases of surviving rabies. But it can be prevented, and one of the ways to prevent rabies is by vaccinating pets, staying away from wildlife and stray animals, and to seek medical care after a bite. And the most important thing is to seek medical care before symptoms begin.
All right, looking at our cases here, very, very different than the previous 2 times I talked. Before we were talking about human cases of things. These are animal cases of rabies. I just want to be very clear that we have not had a human case of rabies in Ottawa County at any time in my point here, or probably in the last 30 or 40 years. But we do keep track of rabies in animals. This is really important because it gives us a sense of the reservoir, which is a big fancy word that basically means, is there a certain species of animal that we're seeing more rabies in? And when we look at the data here, you can see that we get a couple of cases pretty much every year. They almost always happen in the summer, and I have a slide after this just kind of giving you a sense of what animals that have tested positive for rabies. And I don't have any data on here, but generally for Ottawa County, that is usually bats. So don't be thinking like dogs and pets, be thinking wild animals, and in our case, it's most often bats. And so when we look at the state overall, I know the slide is really, really small, and you can find this online, but basically what the takeaway is wherever rabies has been detected in an animal across the state of Michigan, it's almost always a bat. And that doesn't mean like you should go out and cuddle skunks or anything, but at the end of the day, treat all wild animals with respect, but know that in Michigan and in Ottawa County, the main species that could be carrying rabies is bats. If there's one takeaway from this, if you find a bat, don't touch it. Don't touch bats.
Like Darrell was just saying, do not approach, handle, feed, or unintentionally attract wild animals with food, open garbage cans, or litter. Tightly cap garbage cans and feed your pets indoors. Do not attempt to capture or feed feral cats. My daughter's in Ireland right now, and she just told me today that she was trying to get a cat to come up to her, a wild cat, and she knows better. So just a reminder again. Do not pet animals that you're not familiar with. Never adopt wild animals or bring them into your house. Do not try to nurse unfamiliar sick animals to health. Call animal control for assistance in these conditions and situations. Teach your children never to handle unfamiliar animals, wild or domestic, even if they appear friendly. And if you do get bit or scratched by a stray or wild animal, make sure you seek medical attention. Then there are some animals that are considered very low risk for rabies. People may not be familiar with this, but we inevitably, during the course of a year, get called on a chipmunk or a squirrel biting someone because they were trying to feed it. Very, very rarely do rabbits, rodents, mice, chipmunks, opossums. Possums actually like to eat ticks, if you weren't familiar with that. So possums are good, and squirrels, not that you want to go petting any of them because they could carry other illnesses and diseases, but if you do get bit by one of these, it would have to be a very special circumstance for the state to test that animal for rabies because they are considered so very low risk. And then we want to talk about bats. So in Ottawa County, we haven't had a report yet of a rabid bat this year. Last year, I think we had 3, but other counties have. And if there are counties in Michigan that have rabid bats, then probably every county in Michigan has a rabid bat. They don't know the boundaries. But I also did want, actually, my supervisor, Tamara, wanted to touch on the fact that bats actually have some good with them, a lot of good with the bat. And one thing that they do is they are good pest control because they help to get rid of insects. They eat mosquitoes, they eat moths and beetles and crickets, and they help to save producers over $1 billion annually in crop damage and pesticide costs. They also eat rodents and garden pests. So they can pollinate flowers and crops at night, which helps spread seeds that grow new plants and trees. And it was very interesting to note that they're essential pollinators of the agave plant, which is used to make tequila. They can disperse seeds up to 75 kilometers away, which helps maintain the genetic diversity of trees and crops and is important for forest regeneration. Their droppings can be composed into natural fertilizer that supports other wildlife and plants. And bats have inspired scientific discoveries that help humans. So what if you do find a bat in your house? If you have a bat in your home, do not release it. If you find it in the room of a sleeping person, an unattended child, someone who's mentally impaired, or an intoxicated individual. Bats found under these circumstances, they should be submitted for rabies testing. How do we do that? We want to capture the bat in a safe fashion. So you want to wear heavy leather gloves. And what you can do is get a box or a coffee can and you put it over the bat on the window or on the wall, wherever it's at, and grab a piece of cardboard and slide it right under there, and voila, there you've got the bat inside of there, and you did not have risk to getting bit or scratched yourself. Make sure you put some holes in it to allow that bat to get some air. And then here in Ottawa County, we submit animals or the bats through Harbor Humane Society. They will actually humanely euthanize the bat and then send it into the state for testing. The testing for getting the results of that generally take a couple days to get back. And during that time period, if this was a recent event, people usually are safe just to wait it out and see what the results of that bat were. They also do send in other animals as well. We do take seriously, even though we haven't found any dog or cat rabies in quite a while. We haven't in Michigan, or in Ottawa County, I don't believe, many years. I don't have the data on that, but we do also take those seriously. Dogs generally, if they bite and they're not able to show their rabies vaccination certificate, then they're asked to be quarantined for 10 days, and we work with animal control on that. But back to the bats, if there were no exposures, you can release the bat safely outside by bringing it out in that fashion. And then we did use various different resources to gather our information. And do you have any questions about anything that pertains to our discussion today? So, yeah, the question was, if you find a bat in a room with someone that's sleeping, could they have bitten the person unprovoked? Yes. And bats have very tiny teeth, and so you might not always feel it. The other thing that we have, that is thought is that if you wake up to a bat in your room, maybe it did bite you, and that's why you woke up. It's not always easy to find where the bat has bitten you. So yes, if you were sleeping, woke up, and there was a bat in your room, the best thing to do is get that bat tested. So the question is about rabies prophylaxis, and if you were treated with rabies vaccine in the past, if you have another exposure, what the treatment is after that exposure. And it varies, but generally if someone did complete the series, it would be one more. There's varying different reasons why someone might need to restart a series. So we generally tell you to check with a medical provider or the health department in that situation. The vaccine for rabies is 4-part, so someone would need to go to emergency room to get the immune globulin, which is a fast-acting form of protection against rabies. And then they also get the first vaccination at that appointment or at that visit. And then after that, they have to visit, usually they send them to like an ambulatory care center or an urgent care center to finish up the series, but they would do that on day 3, day 7, and day 14. All right, well, thank you very much.